Thank you. Good morning, everybody. Here we are recording another monthly version of Carlisle Community Forum, sponsored by the Council on Aging. It's Wednesday, the 20th of December. The snow from Saturday, the 9th of December, is still on the ground, and we're anxiously awaiting the holidays. We're on the eve of the eve of the eve of the eve of Christmas Eve. So it's right around the corner. Santa's had 2 sightings in town. They've both been recorded in a mosquito. So I think he's gotten what everyone wishes to have for the holidays. And we're really lucky to have a great panel this morning. I'd like to introduce, no introduction needed for most of these folks. Holly Mansfield is the director of Carlisle's recreation program. Betty Lang is representing the Friends of the Council on Aging this month. Angela Smith, I think many of you know Angela, like everybody knows Angela. And you had to live under a rock if you didn't know that Angela was your outreach coordinator. David Klein has been our fearless director for the COA for now
5 or so years.
5 years. Time flies. And our special guest today is Leslie Mae Shabani.
Thank you.
Shabani, who is representing Minuteman Senior Services. And the topic, primary topic today is Minuteman Senior Services, which I'm sure, unlike knowing what you can services you can get from the COA, is a whole new world of things that you may want to consider. So, David, any comments from you before we get started?
Thanks so much, Kerry. I mean, maybe you were going to be using some of this in your introductory remarks, and Leslie's going to talk to it. But if people ever wonder what the umbrella organization is that we deal with, the Council on Aging, to get things done, first of all, there's the Executive Office of Elder Affairs at the state and the Mass Council on Aging, but primarily our local service provider that we interact with is Minuteman Senior Services. And so we'll find out a lot more great detail in the coming moments. But 2 things. First of all, like you, Kerry, I really want to wish everybody happy holidays. Last night was the last night of Hanukkah. Christmas is coming up quickly, and before you know it, we're going to be into a new year incredibly. And also, some of you may have noticed that you receive this Carlisle Connection newsletter thing in the mail every year, or maybe every half year, depending on how often we send it out town-wide. It's our newsletter that we do every other month. Occasionally, we'll do 2 months in a row, and we send it out to usually about 950 people aged 60 and above in town, but we like it's a well-produced document. Our staff works really hard on it, and sometimes it's got information on there that people would want to know, even if they're not an older adult or senior in Carlisle. So that's why we send it out town-wide on occasion. And in the December issue, there is information about people that donated to the Friends of the Carlisle Council on Aging. Nice. And information about what that group does for us, which is so very, very important. And I'm mentioning it because, there might be a tendency to get it and throw it away, but, you might want to page through because occasionally there's some useful information.
Absolutely.
Yeah. And also, for people that may not want to get a newsletter, but want to keep in touch, we have an electronic version that is kind of a condensed thing that we send out once a week called Bits and Bytes. And that tells about upcoming events on a timely basis. And then, twice a month? We send out a version called News You Can Use, which is really not time dependent, but is more just general information that people send us that say, hey, can you get the word out about this? Because it might be helpful for folks. But it's not necessarily date related.
Right, it's more factual things.
Factual stuff,
Yeah,
right? Like if Minuteman Senior Services told us, oh, we're doing this, or we have this service which is ongoing, can you publicize it? We might put that in News You Can Use. But if they said we have a gala party and it's date specific, we might put it in Bits and Bytes. So just our communications pieces, and obviously we're trying to be good stewards of the money and the funding that we receive through grants and through the town. So we're lucky to have a great volunteer that helps us coordinate the electronic version of this, and then we team up with the recreation department to, because they do that fantastic brochure. What is it, 3 times a year?
Yes.
Yeah.
3 times a
Three
year.
times a year. And so we have a page, and sometimes we will share information and co-publicize events, kind of like what we do with the library. So a lot of great partnerships. Anyway, I'll get off the stage, Carrie, and let you jump right into the program.
Well, thank you. I love the news you can use, because it is news you can use. I remember reading about the latest internet scam and not opening certain emails as a result of that.
I think we
thank
stole
you.
that title from you guys, actually.
We did.
We did.
Well, David, you referred to Minuteman Senior Services as an umbrella organization, and I mean, it is literally and figuratively. You can, if you look at the population in the area that they serve, it's from Harvard on the west to Winchester on the right, and everything in between and up and down. I mean, it's a huge area, and we're so fortunate to have the backup, if you will, and another place to go to, even go to first if you know what kind of services you'd like and you understand what they do. So I think we're very happy to have you here to let us know about Minuteman Senior Services and what those services are. And I know that Angela and you, your organization, are joined at the hip. So I know that you don't duplicate things that you don't have to duplicate, but you complement each other. So
Holly has to leave, so maybe we can go to Holly first
sure,
before we
absolutely. Yeah, sorry.
get to Leslie. Sorry about that.
No problem.
I'll cut you off if we go.
This is our newsletter just went out. David had mentioned that this does go out 3 times a year. So the winter spring edition has some new programs for children and adults. We also have a section on trips, which has actually been quite successful for us. So some of the trips we're going to be offering is we have the 9/11 Memorial down to New York City, which has always been a popular trip. Our Majestic Maine Cruise is another very popular program. We also have Block Island, a trip up to Lake Winnipesaukee in the fall to see the foliage, and some other New York City trips actually this time next year. So we do have our trips lined up for all of 2018, and they are in the back of this book. If you have any questions, you can certainly give us a call. But some of our other programs that we're doing, we have our yoga program that we do in conjunction with the Council on Aging, and we offer Zumba and watercolor, and the Friends have actually offered a senior discount. They help us out with that, and help. If you're interested in those programs, there is a discount for you if you live in Carlisle. So those are a few. We did coordinate some programs with the town of Bedford for adult programs, and we have some cake decorating, we have some meditation. The latest thing is sound healing, so we are trying that to see how that works and what kind of interest that will bring in. We also are gearing up for our summer program, and I will start asking for pools. If any resident has a pool they would like to donate for anywhere from a week to 6 weeks out of the summer, we would be eternally grateful. That is a huge part of our summer fun program. The kids, we teach Red Cross swim lessons at the pools, and any time that a homeowner can donate their pool is very helpful.
And the town does cover the insurance for that.
Yes, we do add you to the town's insurance for the time period that you are on, that we're using your home and your pool. So those are just a few that we have. If you have any grandchildren in the area, we do have a lot of fun programs. We just offered an etiquette class, which has been, people have been requesting, because I think social media has taken over a little bit, and we've kind of lost some of the basics, and we're hoping to bring a little bit of that back. We did offer a new series, a before school program, where we're offering meditation classes before school, exercise programs before school, and some art classes. So those are some new things. We're finding that was really needed. It's helping children really get focused before the school day begins, and allows them another little outlet for to release some energy. So those are just a few things. It is all right in here. And
On distribution, that's every household gets.
every household gets a copy. This just went out last week. So if you have any questions on anything, or if you see a program in here that you like, but the time does not work with your schedule, please let me know. Many of my instructors are flexible, and we can certainly adjust days and times or add another session. If you have some interest or have some friends that might be interested in a program, we can certainly work with you on that.
I must admit, I had no idea about the trips that you schedule every year. And and that sounds like a really exciting list of stuff. So.
Yeah, we picked out our favorites. Sometimes they're the oldies but goodies, but they people love them, and it's just it's a nice day to get away on a Saturday or a Sunday. And
that's not necessarily just for Carlisle people. If people have friends that live in neighboring towns or what have you, they can kind of join together and go.
Yes, all of our programs are open to everybody. And the trips we do coordinate with surrounding towns. I work with Littleton and Acton, Bedford, Concord. We all work together to try and get the word out there and let people know about these trips, because they are excellent. We work with Fox Tours, and they do a great job.
Great. Thank you. Thank you
welcome.
very much.
Thank you.
You know, I apologize. Angela told me 3 times that you had to get out of here early.
Oh, no worries.
Not a problem.
Not a problem at all. Thank you very much.
Thank you very much. That's great. Leslie, back to you.
Yes.
From this end to this end. And so senior services, Minuteman Senior Services, large organization by our standards in
Sure.
Carlisle. I think your budget is probably as big as Carlisle's budget. But the area that you serve, the number of clients that you serve is absolutely huge. And can you give us a little bit about you and your background
Sure.
and the organization?
So I'm a social worker. I've been doing this for about 20 plus years and different kind of settings. So I worked in a nursing home as an activity director. I've worked in hospital settings with our care transitions work.
Well, you must have been a candy striper if you've been at it for 20 years.
That's been a while, right? And then with in-home care with the ASAP, or Aging Service Access Point system. So this is a system that's unique to Massachusetts. It is also under the Executive Office of Elder Affairs, and it really is a grassroots movement, unique to our Massachusetts roots with, trying to make something better with governance. And back in the 70s, people really wanted a different option besides just staying at home and struggling or going into a nursing home. So they organized, and the ASAP, or Aging Service Access Point system, was created so that the state funds would be systematically distributed to sort of our hubs, right, our senior services. So every single town in the state has an Aging Service Access Point. We all have the same core services. We're all in an aging network, part of our aging network. We have a business association, Mass Home Care. I should put that up there. And we do a lot of advocacy for seniors through the legislation. And right now there's a lot of things up and that we are advocating for to support seniors in the community. And so we have also federal funds. So we're also a AAA, so the Area Agency on Aging. So we have our state-funded programs, we have our federal-funded programs, and then we also have sort of private pay or grant-funded programs. We're also the Metro Boston Aging and Disability Resource Consortium, and it's really a trend across the nation to kind of pull the aging network and the disability network, getting us out of silos and really connecting so that there's no wrong door. If someone calls us and they have a need that we don't cater to or don't have a service for, we will connect them to the disability network, so the ARCs of Massachusetts, so that you're not just saying, oh, no, we can't service you, right? But we want to make that connection, and they do the same thing, vice versa.
It's like when people walk into town hall and say, I need to get a building permit. Can you show me where? And
Exactly.
And we tell them where to go.
Exactly,
Yeah.
exactly.
So your funding comes pretty much per capita for a number of seniors in a town kind of thing, or in your area?
It's based really on, well, each program is a little different, but certain programs are funded by units. So like our state home care program, we have so many essentially slots for seniors to be able to have that in-home care. For other programs, you get a set amount of money, and then you can, use that to the best of your ability. So it varies. But again, every single town is covered by an ASAP. So a lot of times if you call us and you are not in our 16 towns, then we will connect you to the correct aging service access point. But our mission is really to help seniors with disabilities and live in the setting of their choice. And we do that by connecting folks to services and supporting caregivers. So when Holly was talking about the grandparents, we have one of our programs to really help grandparents care for their grandchildren if they're now the guardian. And I think sometimes we're seeing a little bit more of that, and they may not know that they can connect and get some support through the caregiver program. So this is a slide that kind of shows the towns, and it's 2010 census data, but there's about 60,000, at least from 2010, I'm sure it's probably more by now, of folks living in these towns who are 60 years of age and older. So it's quite a number, and we serve close to about 30,000 duplicated consumers as of last year. But you can see that we have some towns like Carlisle, they're more like rural areas, some that are more suburban, and then some that are almost, a city. So it varies, and the needs of the town residents vary too.
And your headquarters is in Bedford, right?
We are, yes. And then for Carlisle, we do a town report every year, and we kind of show each town the services that were provided to your town, so you have a sense of what that is.
Well, that's called leverage, because you basically double the size of our COA virtually.
Absolutely.
By doing that.
Right.
Yeah, that's great.
And we have a similar mission. I mean, Angela does a great job of knowing who in the town really could use some support and being that point of contact. But she also knows if it's going beyond her scope that she can contact Minuteman, and then we can screen to best match the correct program for them that would help them the most.
And then some of the services are worked on in lockstep, like Meals on Wheels.
Absolutely, absolutely. We couldn't do like our senior dining or Meals on Wheels without the support of the
Local.
absolutely,
Local
and the
people, right.
expertise and the coordination. So we absolutely coordinate efforts. So again, so we're not duplicating efforts and trying to maximize the outreach and the service to folks in all communities. Absolutely, and certainly
And we
Carlisle.
have to credit our volunteers too.
Huge help.
For who are the deliverers.
Right.
We have upwards of 20 of them, I believe, that at any one time are delivering meals.
Absolutely. And it's a huge service to be able to go out and support someone to be in the home. I think that's one of the things that we do well as community-based organizations is to really support folks. It's a functional model, but it's not a medical model like the visiting nurses are. But we really do allow that person to have the shopping or the meals or insurance information or care management so that they can remain in their home and have the best quality of life as possible. So I can go into some of the programs. We have kind of a unique board structure. Our councils on aging, we have a 25-member board, but half of them, more than half, have to be representative from our councils on aging. They also have to be, all 25 have to live in our 16 towns, and more than half, 51%, have to be over the age of 60. And the state did that so that you had local senior control that direct the where we're going. Like we're doing our strategic planning right now. The board is absolutely part of that. Mm-hmm. And so that we're in lockstep with the needs of our community. Through our AAA, we do our area agency on aging, we do a community needs assessment every 4 years, and we create a plan based on what the community says we need. And I know you guys have always participate in helping us understand those needs so that, again, we're in lockstep and the funds from our AAA are going to meet those high priority needs. So we have, like I said, about 25 plus programs I'm not going to get into all the eligibility. It will take me all day. It's a little confusing.
But it's not just low income.
Absolutely not. And I think that's one of the main messages I want to get across is that we want you to understand what the services are before you need them. And our tagline is sort of know us before you need us. We will always be there for you in crisis. We do that every day. It's just easier on folks if they learn about services and understand what they might be eligible for and kind of think through that a little bit before the crisis. If you imagine yourself in the hospital, you're having to deal with an illness, you've fallen, you've broken a hip, something's happened, you have family coming in, it's very emotional. There's a lot of energy, it's time. And now you have to also now learn about all these different things, what insurance covers, what doesn't cover, all these, it's exhausting. So this is a way for us to be able to help you understand what is available to you. But I will say, just call the information referral line. They will listen to your story and they will ask you targeted questions to help, again, understand what's the best program match for you and what you're eligible for. We range from the Meals on Wheels, our Shine program that helps folks understand sort of an unbiased view of what insurance, Medicare insurance options you have. We run our Protective Service program that really is about investigating elders at risk or some sort of financial abuse. Sometimes it could be physical or emotional, and then caregiver neglect. Usually that's just because someone's overwhelmed and they don't know how to connect to service. So we do those reports as well. We also have our caregiver support program and our options counseling program. Those are programs that are for folks 18 years of age and older. And I think, again, most people think of Meals on Wheels or low-income seniors being eligible for Minuteman services. But we do now have a private pay care management program because we, especially in our 16 towns where a lot of folks are house rich, kind of cash poor, they're not eligible for that stay-at-home care program, but need care management. So we started that program to really serve those folks who either by age, if you have a disability and maybe you're younger in your 40s or 50s, you may not be eligible for stay-at-home care, or by income you may not be. So now we have a care management program for every situation.
Well, aging in place is one of the primary goals that we have as a town, certainly. And it's everything goes swimmingly until one of the two people in the household has a problem, and then all the energy from the other person is taken up with that situation, and you can't mow the lawn anymore. You can't change the whatever anymore. And so it's those times when if you know who to call and what services are available would really ease the stress level quite a bit. So as you make your friends before you need them, right?
Exactly. And one of our big aims with prevention work, one of the things that we suggest is not only know us, but know the aging services in particular before you need them, but also taking an action step to build your community care team. We want to frame caregiving, family caregiving, in a way so that you don't think it's all on you or that you have to do this and then become depleted and then have a crisis and then come to us. We want to start it out where we say to have a strong support system is actually crucial in order for the person that you're caring for to be well and that caregiver. One of the main reasons why folks go into long-term care is because that family caregiver can no longer help that person. So it's about having your medical, physician and your specialist, but it's also having a care manager. And it's starting to at least acknowledge who might be a good point of contact for you so that as you go through this, you have it. I think emotional supports are something that are not necessarily seen as important, but as you go through it, you need more of it. And then having like a financial advisor, an elder law attorney. We at Minuteman, through our information referral department, that's open to everyone. They can help you find resources. I'm sure Angela has many resources that she can help, but we just want you to understand to build that community care team, again, before you're really needing it, because it's it's beyond one person. It's beyond one person.
You make me think about what role, the role that the churches play in town is very
Sure.
important in that regard.
Sure.
Because people, just for some reason, don't want to ask for help. And I don't know how we overcome that reluctance, but I know that in some of the church communities, that's sort of a given, that you ask for help because they're, yeah. So are you at all, are they on your radar screen or vice versa?
Absolutely. I think one of the things that we've been trying to do is we do a healthy living program, and we work with councils on aging to kind of connect with consumers. It's evidence-based classes. Essentially, it's lay-led, peer model, where you're coming together to work on education around a chronic disease. And it really allows you to focus on what your needs are, building that knowledge into your routine, trying to change lifestyle. And we have some for caregivers as well, and we're using faith groups to, try to offer them to their constituents too. So any help with that, we would be most grateful. I think one of the things that we're also trying to do is to connect our value of the services that we bring to sort of this kind of talk about social determinants of health. It's across like insurers and everything, and they really are saying genetics is one part of wellness, access to medical care is one part of wellness, but the big part, and that's where I think the community-based organizations play a big role, is around your transportation, your housing, your food security, like with our Meals on Wheels. All those things absolutely play a much bigger role in your overall wellness. And so those are some of the things that we're trying to address.
David, you're probably biting your tongue right now because the...
Well, I'm thinking every time Leslie mentions something, I'm sure Angela is the same way. You think of examples.
Well, but the survey that just has been completed...
Oh, that's true. So an example of that, Carrie, was we completed a community needs health assessment. It was through a Chinook grant.
Yes.
And which is funded through Leahy Clinic locally. And one of the scary things that came out of that was that about 50% of the people in town were saying that if they had an emergency, they didn't have a close friend or relative. Well, they might have a friend, but they didn't have a relative that lived locally that they could call for help.
Right. And that's one of the things, again, as a preventative action you can start taking when you build that community care team, is start looking at who is your emergency backup, right? And that's one of the things like our by-your-side care manager can do that our state home care manager it's a little more difficult. But the by-your-side care manager, if you're alone by yourself, she'll go out to the emergency room for you. She will be there and help you with that transition back home. She will help you even organize your own home. We have one gentleman who was by himself. It was one of the Council on Aging outreach workers who referred him to us because he was sort of off the radar, not eligible for our state home care program. And he was a widow, and he had really neglected his own health. He was depressed, and she was able to connect him back to the physicians, and it became had undiagnosed Parkinson's. But she not only manages his health care, she manages his house, right? He can't just do that anymore, getting someone out to check the heating system, making sure that, the stove is working, having someone come out to do the yard work or the snow removal, all of that. So there are resources for you to not have to be alone or not to worry, right? You can build that community care team and really utilize the continuum of resources through the Council on Aging, through Minuteman, and through all the partnerships that we have. We have about 70 different providers in our network. We all know the community partners very well. So if you call us, we will absolutely help you. Absolutely. And I think that's something that I think folks, you sit with that worry and you think, no, I'm not going to do that today. There's so many other things going on in life. It's the holidays, But if you make a call and you start taking those action steps and start learning and building that team and making connections, that worry tends to go away. You have more peace of mind because you are being proactive and you're building it. It's like your retirement. You learn about this, you build towards it, you have some plan in place. And because you have that, you don't worry as much. You have that weight off of you. And I think that's what we're all trying to do, is to help folks get connected so they are safer, that we know of what their needs are, and we're all working towards meeting that person's goal. What is your goal? We listen to you, we work with you on what is your priority, and we want to make that happen for you. And so it's connecting to services in one way to help with that, but you're running the show. You know, you're in charge, and we absolutely want to fulfill your goal, your wish. And it's about self-determination. So,
Well, I just thinking about that whole process of building a care team, a virtual care
Right,
team. If you
exactly.
don't have relatives, neighbors could be part of that care team.
absolutely.
But perhaps even sharing with folks examples of how other people have done that, what their team consists of. Well, it consists of my next door neighbor. It consists of, you know, these following 4 people that I can rely on for
Right.
certain things. And it's easy to do. And don't be afraid to ask for help. They'd be happy to do it, you know, most
Absolutely.
likely. So I think it would help to get people started in that direction if you could provide examples of
I think
how
that's
others have done it.
more needed in Carlisle because so many people moved here to be alone and to have a lot of space.
Yeah.
And so people are used to being very independent. So it's very shocking to them when they suddenly can't be. And they may not have made those connections because they've been fiercely independent. So I think we very much want people to reach out to us so that we can reach out to Minuteman and to the right organization so that they can stay home safely.
Right.
You know, I think people are afraid that if I call social services, I'm going to end up in a nursing home. And I think that's not what we're trying to do. We're just trying to make you safe wherever you are.
Absolutely. And I think that's one of the best things that you can do is, again, to understand what's available to you. And we're all coming from the same place, you know, to provide you with good information so that you get to make the best choice for you. And we're all trying that. We're all trying to help people stay healthy, prevent that crisis. It's so much more difficult on the family, on the individual. It's so much more expensive to have to deal with the crisis than by putting in a little service at a time when you're just starting out. So I would just suggest, if you're sitting at home by yourself and maybe your family isn't nearby, or maybe you've outlived everyone. We had one gentleman who outlived everyone. And so when we were coming in and looking at what he needed, one of the things that he needed was an advanced care directive, a health care proxy, to make his wishes known. He didn't have any family. Usually you look to family. He didn't have any. So it was a neighbor. We reached out to his neighbor, and with his permission, of course, and had a conversation, helped facilitate that conversation. And she was very willing to be that healthcare agent for him so that she knew what his wishes were. The physician was informed, but that way he had someone who could act on his behalf if for some reason he couldn't. And that really helps, again, you know, implement your plan, your wish.
I think there are a couple examples. That previous slide that you had that said Minuteman benefits Carlisle residents, there was
Yes.
a bullet point, it said a
Sorry.
couple protective services, 11 consumers. Protective services, for people who aren't aware, is a statewide operation through the Executive Officer of Elder Affairs, which then filters back down to the ASAPs,
Yes.
like Minuteman Senior Services. And people may think of it as domestic abuse cases or possibly financial abuse cases. There are cases like that, but the number one type of protective service case, I had just gone through the training
Right.
recently, is self-neglect. And so sometimes people that are self-neglecting aren't really even aware that they're self-neglecting. I think they just,
Right.
things just drop off one thing at a time until they reach a more of a crisis stage, and then somebody notices, that things don't look right with this person. But there are 11 consumers. I'm guessing that those 11 consumers were accepted cases. Those are not cases
Oh.
that were screened out.
Absolutely. Those are investigated.
Yeah.
Right,
So
right.
there's many more cases where there's a suspicion of an issue, and we're encouraged to report those just in case. And then maybe it's really not a full protective service case, but there's one aspect that we can do to improve somebody's situation.
And the other one is if they accept services.
If they
If they accept services, then protective services will step back. It's really about, and their role, they come in, they're very friendly. It's not like the police banging down your door, nothing like that. They're really working, again, to try to help you understand options and to help you to, whatever the barrier is, to help you to accept something that would create a safe situation. And it's about the least restrictive environment, the least restrictive service. They're just trying to, again, offer that option to you so that you can remain safe in your home. It's really about that. So they're not coming in like gangbusters or anything like
Well,
that.
no one's going to take control
No,
over you either.
no,
I think
no.
that's, we have trouble getting people to sign up for Are You Okay?
Yes,
Right.
which is sad, which is
Yeah.
very sad. So if you're out there and you live alone, we do have a wonderful service that's put on between the COA and the police where they will call you at a certain time every day. And if you live alone, if you happen to have fallen and you can't get to the phone, somebody's going to come check on you. And we've had it save lives. We've had people who have fallen and the police found them. And then we've had other people that fell and didn't use it and were found 4 days later when a family member out of state couldn't contact them. So it's free. If you're out there and you live alone, no matter how old you are or how healthy you are, anybody can trip, anybody can pass out, anybody can have something happen to them.
Absolutely.
And it's just a good, smart thing to do.
The senior dining bullet point, it says 73 consumers, but that senior dining, that particular program is once a month for, what, 10 months or 11
10
months?
months.
10 months. So if 73 is the average for each dining monthly thing, that's 730 meals.
Right, right. And I would say with the one thing that I've been learning about nutrition is that it affects seniors, especially as you get up into your 80s. A lot more, you're at a much higher risk for malnutrition. And we've been really looking at prevention around malnutrition. And so our home delivered meals and the senior dining really work towards not only the nutrition component, but a social component. It really does make a difference. The more social interactions and connections you have, it does help you to be a healthier person. And our Meals on Wheels is really not only those two components, but it's an added safety check. So the value of our Meals on Wheels driver is that they see that person sometimes 3-5 times a week, and they're in a position to notice if there's a change of condition, the appearance of that person, the home, how are they doing, so that if they don't answer the door, maybe they've fallen. Our drivers have found folks on the floor or know. They always report out if someone doesn't answer, then we follow up to try to find out did they have a medical appointment or what happened. But we have had the first responders come and find somebody on the floor. And so it's an added dimension to just having, making sure that you have nutrition. But I think for any chronic illness, for any aging issue, for any hospitalization, nutrition is so important to staying healthy. And again, it's a preventative. It's so much easier and so less costly to provide a meal, even if it's on a short-term basis. There's no income eligibility for that program. It's really about age and if you're homebound.
Mobility.
And if you're younger than 60, you can pay for the meal, and we will deliver it. So it is available to you if you're having, some kind of condition where, a situation in the hospital, or maybe, I don't know, something happened to you where you can't get out to shop. But that is available to you as well. But that's a key
How's our
piece.
capacity for expanding that program in Carlisle? Do we have capacity?
Yeah, we have a good number of volunteers, and we can always use more, but we could definitely do more.
Yeah, I mean, I think, as you know, and you were referencing the church community, which does such a great job. There's funding available in emergencies through the three churches. And also, because we don't have our own community center, senior center at the moment, we have events that occur here in Town Hall. But mainly, it is happening within the churches, St. Irene and First Religious Society and Congregational Church, and we rotate through them. It is a little bit limiting. It's great. It's wonderful community
Yeah,
work,
absolutely.
but it is somewhat limiting in that you don't have your own facility. As wonderful as people are, you're
We
still
can't do it as often.
we can't do it as often, exactly. So for example, in some towns, they'll have more formal programs a couple times a week rather than a couple times a month. But they may have informal nutrition programs too, where you can drop in and visit a cafe.
Right. Absolutely. Absolutely.
So who do you call?
So I would say you certainly know Angela. You call Angela. She, if it's beyond her role, she will certainly make a referral to Minuteman. I would also encourage you, though, to call Minuteman and just talk about your situation with the information referral line, and they will walk you through it. If you want specific information from the buyer side care manager, you can call her directly. Her email and the information referral person will get it to you. But she can walk you through any situation if you aren't eligible for the state home care program for care management, or you're underage for income or age. But yes, just call.
Well, it's terrific leverage for a town this size to have. And I know we use a lot of $230,000 worth of services every year, and that's great leverage for us.
Yeah, no, the town funding for our department is not lacking. It's more of a kind of a space issue, but because of all our volunteers, we have upwards of 150 in any given year people that are helping. And we have the support of our ASAP Minuteman Senior Services. As you said, it's a matter of leveraging your resources.
Right. And we have about 900 volunteers that help us with our SHINE program, our money management program, our ombudsman program, and certainly our Meals on Wheels program. And we can't do it without the volunteers. They're a huge aspect to the work, and I'm just amazed at the commitment that people offer and their kindness and just commitment to it, and it makes a huge difference.
You might not know this. You probably would know our SHINE counselor, Clyde Kessel, but he also manages our durable medical equipment program.
Yeah.
And is running back and forth to the town shed. I'm not sure where the durable medical equipment is scheduled to be. Is that one of the things they were talking about for Highland at some point?
Possibly, yeah.
Yeah. So we don't have our own building, but we do have our own space where the medical equipment
Right.
is stored.
Right. And we utilize that as a resource all the time. If someone's coming home from the hospital or if they have a condition change, the care managers, our options council, caregiver information for all know to tell people, ask your outreach worker at the council, because they really may have a donated item that would really save you some money, and you can get it right away. And we've used that in several cases. Even by your side with the private pay, we've said that to folks, and it really is helpful. It can get you something where the insurance may take you a while, or you don't have to pay out of pocket, and it's wonderful. It's a great service.
And if we don't have it, the Friends has been very good to provide additional, when
Funding.
we've run out of transfer wheelchairs or we've run out of rollators, then we'll go to the Friends and order something and, keep it in circulation.
Right. A lot of times it's only a finite time period that you need something, so you,
Right.
Right.
So most everything is finite. It's usually somebody's coming home from the hospital, so they only need it till they're back on their feet.
Leslie, anything else you'd like to add before we turn the program over to?
I would just say thank you so much for having me on. We absolutely value our partnership and collaboration with the Council on Aging. And I think if you can just maybe be brave and take that step and start just learning about what's available to you, it will help you so much to have a better quality of life and help your family through any kind of health incident or event that comes across. And again, we're there for you always, but it just is easier on you. So thank you so much.
Thank you very much.
Thanks, Leslie.
Thanks, Leslie. We really, and we're understating Leslie. She introduced herself as a social worker, which is, I'm at your heart, you're a social worker,
absolutely.
but you're also the assistant executive director. So
Yeah.
that's so important. For a large organization, how many overall employees?
We have about 137 now, and like I said, it's like 900 volunteers, so
Yeah.
it's a big group. And we've been around for about 40 plus years now, the ASAP system. So,
Right.
Terrific.
Yeah. A lot of committed people.
absolutely, yeah.
So, shall we talk a little bit about some of what we have coming with the COA before we have Betty tell us what's going on with the Friends? I'm just going to try to hit some of the things going on in January. Our newsletter for coming up that people will be getting hopefully at the beginning of January is January and February. So we have a monthly coffee at Village Court on the 3rd, and we have Chelmsford Crossing lunch, which will be at St. Irene's on the 4th. And after that lovely lunch, we're going to have Abba Sengal, who's one of our board members, give a presentation on her trip to the Great Wall of China. So that should be very interesting. And then on the 10th, we're going to eat lunch at Neshoba Tech High School. And we have senior moments at Ferns on the 8th and the 22nd of January. And if you haven't done that and you happen to be in town on one of the Mondays that we do it, it's lots of fun. The COA pays for the pastry, and you can get your coffee at a 10% discount. And people just chat about what's ever in their mind, what's on the news. It's a great way to connect and
When is
stay
that
in
again?
touch. It's Monday mornings. It's the 2nd and 4th Mondays of the month from 9:30 to 11 at Ferns. And
We have to credit Ferns too, because I think, they charge a nominal fee for the food, but I don't think it really covers their
I'm
costs.
sure not.
Right.
And so a lot of people get together. It's usually 8 to a dozen people.
Bring your own bottle, is that?
Yeah, exactly. Bring your own wine.
And it's a wonderful, stimulating conversation. And on the 4th Monday, we do have a nurse there as well to take your blood pressure. And then we'll have men's breakfast on January 11th. And our COA lunch is our annual bingo. So if you have something you get for Christmas and you don't really think it's you, bring it in and we'll put it towards our bingo and re-gift it. And quarterly, we do breakfast at Neshoba Tech, and they have the most amazing breakfast, and that will be the 31st.
You can order Eggs Benedict, I
You
believe.
can order Eggs Benedict, and it is so good. So,
Neshoba also has a buffet on Fridays.
yes, I heard that. We haven't done that, but I heard that there were a number of people who were trying to get together and do that as a group, because the food's so good.
They do a great job,
They
yeah.
really do. And the Friends subsidize our being able to go, which was an idea David had, and that's really increased attendance. We used to have maybe a dozen, 15 people go, and now we're getting 30 people who go. And so it's a wonderful way to connect, socialize, and have a wonderful meal for $5 plus a tip.
You were, yesterday in our board meeting, Kerry, you were mentioning that complimenting the people that did the long-range plan. And one of the goals of the long-range plan from a couple of years ago was to add another meal to our repertoire. And the problem, of course, is the challenge of adding another meal is, okay, where and how do we do it? But that was, in discussing things, how do we kind of accomplish the board's goals? We realized that in Neshoba and at the time Minuteman as well, that we were already going there. It was just a relatively small group of people because the meals, I think, are $10 plus
Right.
tip. And so we thought, well, if we are subsidizing it, that's virtually the same as creating our own meal and paying for the whole meal ourselves.
Right.
So,
Well, that was a great call to subsidize it, because the 30
Yeah,
people.
I
as
was
you said.
shocked at
Right.
how much impact it has.
Well, the other thing, the men's breakfast, I must say, at Village Court, They have a terrific chef. I think his name is Smith.
Yeah, it's my poor husband who got pulled into
Volunteering
doing
to
God knows
be
what.
there at 6:30 in the morning to get the
Yeah, he leaves the
grill
house
warmed up.
about 6.
He makes a great frittata. It's a wonderful breakfast. It really is.
And where can you get as much as you can eat breakfast for $3?
Police chief always comes for breakfast, so if you need a ticket fixed, he's right there.
I doubt that's going to happen.
Chief Fisher's very good about supporting us in that respect, and he gets a good hot meal out of it, too.
He does.
Yeah.
Yeah.
We've got a couple other things in January coming up. We've got our podiatry clinic on January 2nd, which is a Tuesday, right after New Year's. And then there's a second day, Monday, January 8th, and I believe, correct me if I'm wrong, it's because the podiatry clinic has actually become so popular that the podiatrist, the doctor, Gregorian, needed to split it into more than one day.
Right. We're doing about 40 or more people. So it was too much for one day.
She's been doing it now for about 5 years,
Oh,
right?
more than that.
More than
It's
that.
more like 8 or 9.
Oh, my gosh.
And I think, she started off with us, but now she's actually doing a couple other towns. But one announcement about that is that she decided that as of January 1st, that she had to increase her prices by $5. The Friends are subsidizing, they were subsidizing $10 out of her $30 fee. So it was a $20 cost to go, and we were paying for $10 out of the Friends grant. So now it'll be $35, and people will be paying $25, and we'll still be subsidizing the $10.
Right, but even though her price went up in January because we didn't have time to tell people that for their January appointment,
That's right.
we're not increasing it till March from people's perspective.
Right. And of course, if anybody cannot afford the price increase or the appointment at all, come and tell us, and we'll try to work with them.
And that's physically conducted here,
Usually at Benfield.
It's at Benfield.
Banfield, okay.
There's a nurse's office
Yes.
at Benfield, so that allowed people to have more
Sure.
privacy, and so it's done there.
And we should credit Dr. Gregorian in this case because she donated an older podiatry chair, which must have weighed like 400 pounds. We had to move it over there. We actually had to use the wheelchair lift in the van to move it.
Well, her clients now are old friends at this point.
Probably so,
Absolutely,
yeah.
absolutely.
Yeah.
So maybe before we go on, since we have more things to say, we can give Betty a few minutes.
Well, I thought you were waiting for the best for the last.
Wow, almost.
Okay. My name is Betty Lang. I've been on the Friends Board for many, many years. I believe this is coming up our 27th year. Doesn't seem possible. Our goal is, we are a nonprofit organization dedicated to the seniors of Carlisle. To begin with, as many of you know, we're in the middle of our fundraising season. I want you to know where your funds go. Everything that you donate through the Friends Annual Fund goes to the COA. The COA has asked, and we have agreed it's a good thing to, once a year, at their instigation, they make up a budget, which we now call a grant, for things that the town either chooses or cannot afford to provide for seniors in town. It's a wonderful group to work with, but we have so many generous donors in this town that it's wonderful. We do thank you. Although things are going very, very well this year, we still are not quite at our goal to fund the grant for the upcoming year for the COA. So if you haven't donated, please consider sending us a donation. We do many, many things. We support many, many things. One of the things that I know is coming up in the spring, and I know how popular it's been, is that we, along with the Gleason Public Library, have, well, this is the 14th year we've been doing it, a cultural lecture series. And this year, It is Janet Blair. She's been here before, educator and owner of Art Times, and she will return to Carlisle on Wednesday at 1:30 at St. Irene's. March 7th is Women Artists, Part 1. March 14th, Women Artists, Part 2. And March 21st, Portraits in Art. It's a wonderful program. Registration has to be in by January 15th for this
Well,
series.
it will start January 15th,
Okay.
registration.
Registration will start January 15th. And I encourage you to do it because I know that they're turning people away many times.
I think that might be our most attended event.
It is.
I think so too. So we do thank you. If you, again, have not donated to us, may I ask that you consider it.
Where can I send my check, Betty?
To me. You can send your donation to Box 38, Carlisle. Send it to the Friends of the Council on Aging. If I have time, it might be interesting for me to tell you why the Friends came into being. Many, many, many years ago, a notable person in town died, and the family left a group of money. I think it was $1,500. And if it went to the COA, then at the end of the year, that $1,500 would be returned back into the town coffers. Well, that wasn't the purpose that the person had in giving this money. So that was the beginning of the Friends. We decided we needed some place to put this money where it could be put to the use that people intended it to be. And that's still what the fund drive does. It's intended to benefit the seniors of Carlisle. So I do thank you for your past donations. I hope you'll come to some of the events. And I thank you for inviting me here today.
Post Office Box 38.
38.
38. And you've been at this for a long, long time.
I think I've been with the Friends in the COA maybe 20 years now.
So not only programs, but food assistance, fuel assistance. The grant covers a lot of areas, doesn't it?
It does. And when we have other people come that have COAs, they are, and you'll shake your head, yes, they are amazed at the amount of activity we have in this town. If you're a senior and you're a little shy about going out, you shouldn't be, because these activities are just wonderfully helpful. You have a good time. Nobody is going to ignore you. You'll sit and make friends. The exercise is wonderful. And this program here is a wonderful thing. I have had people come up to me and say, "Oh, I saw you on TV." You did? Well, I don't have a show. They watch it. So if you want to help your neighbor who doesn't watch it, tell them about it. You'll see some familiar faces, and you'll learn a lot of good things that will help your life be better here in Carlisle.
And I'll just highlight, there's 2 computer classes coming, one in January, one in February. So if you'd like to join us again, either check us out on the town website or look at us on CCTV.
Good content, learned a lot. Thanks very much.
Thanks, Cara. Happy
Happy
holidays.
holidays.
Thank you.
Holidays.